Objective 7.2. So all of the muscles that we are going to talk about today are called intrinsic laryngeal muscles, meaning that they move the laryngeal cartilages. All of these muscles, except for one, are supplied by the recurrent laryngeal nerve, which is a branch of the vagus nerve. The exception to this is the cricothyroid muscle, which is supplied by the external laryngeal nerve, which is a terminal branch of the superior laryngeal nerve. So we can look at these intrinsic laryngeal muscles in two categories to help us understand them better. So first, there are the muscles that affect the tension of the vocal cords, thus controlling pitch. So first we have the cricothyroid muscle seen here, and this raises pitch by tensing the vocal cords, and it tenses the vocal cords by lengthening the vocal ligaments. And it pulls the anterior thyroid cartilage away from the arytenoids, and it pivots at the cricothyroid joint, kind of in a rocking motion, as you can see here. And remember that the cricothyroid muscle is the only intrinsic laryngeal muscle that is supplied by the external branch of the superior laryngeal nerve. The rest are supplied by the recurrent laryngeal nerve. Okay, so next we have the vocalis muscles and the thyroarytenoids. And these decrease pitch by relaxing, or you could say by shortening the vocal ligaments. These muscles pull the arytenoids and the thyroid cartilage closer together to do so. So the next category of intrinsic laryngeal muscles are those that change the size of the rima glottis. And they do this by either abducting to open the rima glottis, thus opening the vocal cords, or they adduct, thus closing the rima glottis and closing the vocal cords. And we can see those muscles here from a posterior view and then from a superior view. So first let's start with the muscle that abducts. The only one that does this is the posterior cricoarytenoid. And it does this by rotating the arytenoids laterally, as seen here, to open the vocal cords. And now for the muscles that adduct. So those are the lateral cricoarytenoid, which closes the vocal folds by rotating the arytenoids medially. And then we have the transverse arytenoid and the oblique arytenoid, and these both slide the arytenoids together, thus closing the rima glottis.